Hi, everyone. This is Ilium 360. And as you know, just a group of individuals who have decided to try and simplify some of the research findings in areas that affect us the most. And as we started last week, we had a series on diabetes, which was led by our sister, Rhoda Anna-Nekakari, who is a PhD candidate in human biology at Ludwig Maximilian University in Munich at the Faculty of Medicine, and was also helped by our brother Enoch Mensah Boateng, who is an applied zoologist and a parasitologist at the Czech University of Life Sciences in Prague. I am the host, Enoch Kusi, and my co-host is Mr. Jonathan Sarkodie. Welcome, everyone. So today, last week, we kind of did about a broad overview of diabetes, some of the risk factors and things that could make someone prone to having diabetes. Today, we are going to look more at the diagnosis aspect of diabetes, how to find out if you have a diabetes or not. So I'll leave it up to our experts to take us to that.
Yeah, thank you, Enoch. And thanks for giving the background information, where we started from and where we are so far. And today's discussion would be a continuation of what we have done so far, and we will take it in a different format. I think today we're going to have a discussion slide by slide. Let me see if I can make us appear bigger or show some more active speakers. Oh. Okay. Yeah. So as I said, not to communicate in scientific terms, we will probably want to bring it to the level where an ordinary person would understand. And so we're going to talk about importance of early detection of diabetes. And this also means that people should know their blood glucose levels and possible associated complications. Last time we did talk about risk factors. We also talked about causes, and then we talked about signs and symptoms. One would ask, if I have any of these signs and symptoms, does that mean that I am diabetic? I think from my perspective, that is a no. That can suggest that you may have diabetes, but that doesn't mean you have diabetes. If I am, for example, we said people age 35 plus are at higher risk of getting diabetes. If I'm 35 plus, if I'm 40, does that mean I have diabetes? No, you don't have it. You have to detect it. You have to get diagnosed. An expert has to test you to find out that you are diabetic, and that is what it means to say to be diagnosed of the disease or not. In medical terms, several diseases may exhibit the same symptoms. So symptoms and signs, in my opinion, are not enough to say one is sick of this disease unless a confirmatory lab test or required specific test is performed on the individual to ascertain the status of the person. So from here, I think that we will dive into what it means to have diabetes. And I think I would let Rhoda start, and I will join along the line.
Thank you. So looking at the diagnostics, I think here you have given us an example of a fasting plasma glucose test and the range it should fall into. So what this fasting plasma glucose test usually, during this test, what is done is that the person or the patient is told to fast for at least 8 hours. And usually it's overnight. So it should be 8 hours after your last meal before bed. But during these 8 hours, you are allowed to drink water, but not excessively, but your normal water intake. And this blood test, or the blood, is drawn early in the morning, right at the end of the fasting. And with this blood, at the laboratory, they are able to detect in the plasma of the blood to test for these glucose levels. And for your fasting plasma glucose, if it is less than 100 milligram per deciliter, this is for a normal person, but if you are pre-diabetic, and as we explained last week, we said that someone is pre-diabetic if you don't have detectable levels of, or you don't have high glucose in your blood for us to say that you have high glucose, but then you are almost getting there, you're almost getting a high blood glucose. So in this pre-diabetic state, we're able to know from your fasting blood glucose if you are within 100 or greater than or equal to 100 to 125 milligram per deciliter. And if you're above 126 milligram per deciliter, then we can say that you are diabetic. But of course, aside the fasting blood glucose, there are other testing methods which we can also use. For example, we have the oral glucose tolerance test. And for this oral glucose, as the name implies, the person is given a particular volume of glucose to take. And all these tests, before that also, you are also required to fast at least 8 hours overnight. And in the morning when you present yourself to the clinic, you are given a glucose solution to take. And at small time intervals, like before you take the glucose and some minutes, hours after you have drank the glucose, blood is drawn, and then the clinician is able to detect glucose from this blood which has been taken. And when we look at this fasting plasma glucose, we said the normal level is like less than 100 milligram per deciliter range. But for the range for the oral glucose tolerance test, it's a bit different. It's a bit higher than the fasting, because here you have been given glucose. So it means that you have eaten, you have been fed. So then your blood glucose level is higher. So then the normal person will be between 140 milligram per, less than 140 milligram per deciliter. And if you're pre-diabetic, you're usually between 140 to 199 or almost 200 milligram per deciliter. And if you hit more than 200 milligram per deciliter, then we can say that you are diabetic from this test. And of course, there are other several tests which we can do. And I think not to bore us so much, I'll ask Enoch to also chip in, and I can also bring another input. Yeah, thank you.
Thank you. So depending on the stage and the time in your life where you are going to check your blood glucose level, your medical officer will recommend certain tests to be done. One of them is the long-term exposure or long-term blood glucose level of the patient, and this they measure it to see the consistency of your blood glucose between 2 to 3 months. And again, the values are lesser than what you will do when you are doing the fasting plasma glucose test, because it is a long-term complication or compromise or exposure in this case. So one thing that we should know is that it requires a medical officer to do this, and we're just trying to let people know what your medical officer and the laboratory technician will be looking out for when they want to detect your blood glucose level, or when they want to detect whether you are diabetic or not. This information doesn't mean that you can go about and do things yourself and think that you can know your blood glucose level. No, your doctor would ensure that. Probably I think that the doctor should be in the position to say this and that, but for this value, we're just putting it out there to let people have an idea how to categorize blood glucose or blood sugar level to determine whether one is diabetic, pre-diabetic, or not diabetic at all. And and I think if you are normal, it doesn't mean that you wasted time to go and check your blood, because people think like when they walk in there and then they don't feel sick and they go and check and nothing is happening, it's a waste of time or it's a waste of money. Rather, I would say that it will help you to put the necessary preventive measures in place not to get there. And if you are sick, you may have the opportunity to manage it in such a way that your life will be prolonged. And if you are pre-diabetic, Rhoda said previously that his father detected that he was pre-diabetic, and he has stayed there for several years and has not gotten to the diabetic stage because he was aware of it and took measures not to escalate it. So it is very important to detect your glucose level or to know your status as early and as frequent as possible so that necessary measures will be put in place.
Okay, thank you very much. So I have a few questions. Recently in Ghana, when you go to the hospital, right, they check your weight, check your BP, check your blood sugar. They don't even ask whether you are fasted for 8 hours or not. So is it only, do you have to only test it after fasting, or you can still do some tests even if you have eaten?
Okay, so there are other tests that we have not mentioned. Just this was just a model to talk about the other tests. So yes, the test can be done even if you have eaten. And again, like Rhoda said, if you have eaten, just like in the case of the oral glucose tolerance test, if you have eaten, then the range will also, if they test you, the range of the values will differ from the fasting plasma glucose level. And in the case of people who are maybe diabetic already and they have the self-testing equipment to test themselves on regular basis, they can eat and still be able to test themselves. Yeah, Rhoda will come in now. You are muted.
If you are not fasting, and then I really wanted to also say this, and aside the doctor not asking, a lot of people when they are told to fast, like, oh, so how can the doctor know I have not fasted? So this fasting is very important to have a baseline glucose for us to measure what is to come. So the fasting does not decrease your glucose or doing, but it's just stabilizing. It's just creating like a baseline to help the healthcare worker to be able to detect or test these things for you. And if you look at what your question also, we also have other tests that Enoch mentioned already, but because he simplified it, so I think he kind of missed it. In hospital, they call it the AIC or the HB1C. I think last week I mentioned about the HbA1c. So here what they are doing is that the good thing about this test is that even if you have eaten, you can still take this test. But when we take this test, it's not a one-time short test. It is a test which you take in accumulated time. Maybe we track your glucose level for 2 to 3 months. And here they are able to see how much of your blood protein, hemoglobin proteins have been coated with sugar. So here they want to see that in your first state, like in your normal life, how is your blood glucose like, irrespective of any baseline measurement. But for fasting blood glucose, as the name implied, it's a fasting plasma glucose test. You have to fast to take this test. And for the oral glucose tolerance test, you also have to fast to take glucose. So it's like you already have the glucose. Maybe you just ate ampicea, or maybe you just ate fufu. You have glucose already in your blood. So if we make you drink extra sugar is soluble, so then it stays more in your blood than this glucose. It can make you have irregular values, which might not be because normally you have higher blood glucose. It's just because you just ate something extra. So then I think it's advisable that we fast before. And that's why this video is also very important for us to educate ourselves. So you can always question your healthcare profession or professor, the healthcare worker, that why am I not fasting to take this blood test? I think it's also allowed. Yeah, thank you.
As a follow-up to what Enoch asked, that with the presentation, the answer Rhoda gave, the AIC test, the one that is taken consistently for a period of about 3 months. How regular do you have to take that test for that measurement? Is there any timelines for taking that so that it could be used to determine, or as determined by whoever is in charge, the healthcare professional that is actually looking at uh, this kind of test?
Okay, so yeah, I think that I will just come in and then Rhoda might join later on. The healthcare professional will determine, and I think for this particular one, so the point is that if you do the first test and probably it is established that you are not diabetic, you are not going to go through this. But maybe after several tests, when they know that this is how you are reacting and stuff, subsequent confirmatory tests are needed to probably design a management plan or a treatment plan and stuff for you. And that is where they would want to monitor consistently. And it will be at the discretion of the health worker or your personal doctor, if you have a personal doctor or whatsoever. So you don't decide that every day I'm going to ask my doctor to text me for this particular parameter consistently. No, your doctor will give you time and days to come for such test. If Rhoda has something more to add.
That if our listeners can also go back to our previous video, which is very insightful, because then you are able to know who should get tested. I think that's the question. So if your doctor determines that you should get tested based on all the risk factors which Enoch shared with us last week, then he will give you, or he will propose a test which meets your need or depend on your medical condition. And so it's not a test that, I know that in Ghana, there are lots of private medical laboratory where people can just walk in and do a lot of testing upon testing, but you have to, it's good to have a routine check, but this is not something like, it's not a routine test that you have to check periodic. I mean, you have to check maybe once a year, but usually it's determined by your doctor. So he tells you to do this test based on your risk factors and also based on your current medical state. Or yeah, then you can also do that. Or if you also fall into the category where you are above 35, and as we mentioned in the previous video, and you think that, oh, I just want to have a normal routine blood glucose test, then you can opt for any of these tests that we have mentioned here at a private sector, or you can also ask your doctor. Yeah, I don't know if I answered your question.
Yeah, thank you, Rhoda. You almost answered my last question on this, on the types of diabetic tests that are available. Yes, it will be prescribed by the health professional depending on your condition. But then, on the surface of it, do we actually say one is potent than the other, or it depends on what you are using it for, when you are using it for, so that at the end of the day, if I'm going for a test A or B, I can know how reliable that can be?
Okay, that's a very good question. I think before then, in this slides, you can see that we have normal person, we have pre-diabetes, we have diabetes. So let's start from the end, the diabetes. If you have already been diagnosed and you are aware that you are diabetic, you have to usually have a random or casual plasma glucose test. And this individual, I think in our next slide, Enoch will give us more information on that. And then you have to randomly, and we will give you tips on the next slide, how often and when and how you should take this test at home to help you. That is for someone who is diabetic. So there, you always have to have this strips at home and casually, randomly take this test. Are you normal or pre-diabetic? That we cannot determine with a random test, which we would teach in the next slide, like just a prick or something. For me personally, I will recommend the oral glucose tolerance test. I recommend this one because when you drink the sugar and then we are able to check your blood glucose, not only are you able to check your diabetic state, but then with this blood, your insulin levels can also be determined. Because if you have glucose intolerance, usually that is if your body is not able to clear glucose, and you are nearing becoming diabetic, it's most highly that you also be insulin resistant. So which I mean is that your insulin sensors might not be working well. And how do you determine that? The doctor or the lab technician is able to get these two information when you do the oral glucose tolerance test. And based on the range, as we have discussed, he or she can help you better know this information. Of course, you can also go for the fasting glucose test as we have listed here, but this is this also can give you all this information, but personally, I prefer the other one to this, but any one of them, based on your health state, your age, your condition, then the doctor will recommend which one is appropriate for you.
Quickly, I'm not adding to anything, but I'm asking a question. Is there any sign or symptom that one must look out for to know that they are glucose intolerant, even without the test, the oral glucose tolerant test? If you have any information, if you don't have, that's fine. Rhoda.
Okay, well, so I think there are a lot of them which you can look at for. I think last week you even mentioned some of them, like increase in thirst. Like there are people who are often very thirsty for no reason, frequent urination, all these things. And our bodies speak to us. If something is wrong with you, you definitely know if you pay attention to yourself. But often at times we just ignore it because sometimes we are afraid of the consequences when we probe into what is really wrong with us. But I think if you take a step back and you look at all these things, it sometimes can give us the signals for us to know that we need more testing on our blood pressure or diabetic state.
Yeah, so for the types of tests, we have already talked about a blood test. So we're not going to dive into that one, but the other tests there are physical examination. This is usually done on people who have already been diagnosed with diabetic, right? And they do this to also see the impact of the disease on other organs, be it the kidney, the lungs, the heart, the nerves. The nerves, they do the foot examination. They look out for some ulcerations, some dryness, some sensitivity in the nerves in the foot. And with the skin, they look out for some ulceration as well, dryness, some rashes, unhealed wounds and stuff. They can also do the heart rhythm and the heart beat test, because as I mentioned, diabetes can affect the functioning of your heart in such a way that there will be unrhythmic beat of your heart and stuff arising from diabetes. So these physical examination tests are also done to collaborate the blood test to identify if the diabetic status is affecting some organs function in the human system. Here, the doctor will diagnose you and tell you you are okay or you're not okay, but we're just trying to expose to you what actually the doctor is looking out for. They can also do eye examination, eye test, because we also mentioned diabetes affects the heart, the eye, and your sight becomes blurred and stuff. So all these are done to know that this is the status of the person, even if the person is already diabetic. This is the level of complication, and this will guide them to design a treatment routine, or if you are not diabetic, you have information about measures to put in place to prevent getting there and stuff. And then the last one is the urine test, which is not a test that is definitive to determine that one has diabetes or not. It is used to complement the lab test. Even the lab test can stand on its own, but sometimes they want to see also the impact of the diabetes in the functioning of the kidney. So if a certain level of sugar or glucose is identified in your urine, then it can tell how effective your kidney is working and some organs are working. However, we should note that the fact that your blood contains urine, your urine contains sugar doesn't necessarily mean it's as a result of diabetes. Research has shown that there are other reasons why urine can have a high sugar level. And this we are not going to dive in because it's not the focus of our discussion today. But I just wanted to mention it that when you are diabetic and you go, when you are not and you still want to know, the blood test is first. But if you are determined to be diabetic, the physical examination, ECG, and then the urine tests are also part of some of the complementary tests that they can do to know the complications associated to your diabetic status.
Okay, that's fine. So, talking about the urine test, there are some ancient ways of testing. So, like color of your urine. I know it might sound nasty, but people actually say you should taste your urine to see if it's sugary. And then the old age ants on your urine. So if you urinate somewhere and it attracts ants, it means that you are probably diabetic. Are those some of the things that we can look out in terms of the urine, knowing that we have diabetes from our urine?
So, like I said from the beginning, signs and symptoms are not definitive means to know that you are. It could be, but you have to run a confirmatory test. Whilst they may suggest the possibility, it is inconclusive to say that because I'm how comfortable are you to determine to taste your urine? And secondly, how do you determine that your urine has too much sugar? What is the baseline? What is the reference point? If you have not tasted several,
maybe you've been tasting it, so you realize that, oh, it's too sugary today. Oh yeah, you realize.
Yeah, so in any case, what I would recommend is that go to the hospital, go to the laboratory, get them to do this for you. If in the laboratory, I will recommend if it's difficult getting a doctor appointment and stuff, but always you have to confirm that your signs and symptoms are reflective of what you think it might be otherwise. And like I have said, that the urine test, the fact that you would have too much sugar doesn't necessarily mean you are diabetic. It could be other reasons that are not open for discussion here.
And I also think that traditionally, there have been people whose urine attracts ants, and usually it occurs when you are at the advanced stage of diabetes. And so if your diabetes have developed far ahead, you could have smelly, some people say sweet, but I don't know how it is, but it's just textbook. They say you have some fruity smell. But what I know is that, yes, it's possible for some people's urine to attract ants, but usually when you see the sign, it means that you are far ahead in that you are diabetic already for your urine to attract ants in this way, because as Enoch said, then it means that all the other things, other components in the urine, like ketones and other things, have built up in the urine, and this is all contributing to this kind of factors. So I think that is why today we are stressing on early diagnosis for diabetes, because it's very, very important, especially for the pre-diabetic state. People don't show any symptoms or any signs. You can only see this if you get regular checkup. And then we are able to see that you are progressing into diabetes. But for our listeners who are already diabetic, then we encourage them to go for all these tests that we have, and also visit the hospital. They shouldn't miss the appointment. They should go for the appointment. And adding to the physical examination, as Enoch already said, like last week, we mentioned that diabetes can have a lot of complications. And these complications are very irreversible, like your leg being amputated when you have kidney damage, or maybe you have a liver problem, or you have other blood visions. These are all end stage of the diseases. And if you're already diabetic, then you should have periodic tests, a physical examination to check your feet regularly, to do other internal organ tests, check your blood pressures as recommended by your physician, and take all this physical examination very seriously. Yeah.
For the purpose of clarity, I think you said it. Is it the case that for a confirmatory test, it is the blood test, and that the physical examination and the urine test are complementary, only complementary?
Yeah.
Okay.
And one last thing I want to talk about here, or we want to talk about here, I know Rhoda wanted me to change how it looks like, but also I want us to even more focus on the two photos, what we see in the two photos. Because in developing countries where access to healthcare facilities are quite distant and not readily available, where you can be in a queue for several hours before you get access to doctor, and sometimes even in some clinics or health facilities, you don't have the the capacity to do the lab test, there is the self-testing device, which I would refer to here as the glucometer, right? And that is in the hands of the white lady in the left. And then there is somebody doing some typical lab test analysis there. And here, I wanted us to talk about the fact that, especially when people are already diabetic, they are admonished to test regularly, and this they can do at home. They are trained to know how to do it and all that stuff. But with this home testing regular stuff, there can be variation in the values, and also compared to the typical lab setting test, the accuracy can be somewhat inconsistent. So one thing that is recommended is that to use the self-testing device, it is important to be sure of the calibration. So ideally, maybe if you are going to hospital to do the regular check, like Rhoda mentioned, the test that does not rely on whether you have eaten or not, then you can go with this device. When they take the blood sample, they can use the device to test first to know the value or the readings, and then the blood. If there is consistency in the lab test results and then the glucometer results, then you are safe probably to use it. But there has been a research where about 41 data entry from glucometer and lab test in the same hospital differed in terms of the variation. But by research, if the range of values for glucometer reading is 15 to 20% more or less than the blood test result, it is considered reasonable and it is the accepted range. But where the difference exceeds 25% to 50% and stuff, then there is something definitely wrong with the device you are using, and it is required to fix that. Why is this necessary? It is necessary because if you overestimate your sugar level, you may be taking medication where you don't need to. And if it underestimates your glucose level, you may be unboarded where you needed to be boarded and take precautionary measures. And so it is really important to know that sometimes differences exist, especially depending on the brand of glucometer that is being used in the various homes to do the blood glucose reading. And also, glucometer assess a whole blood sugar, but the lab test mostly they do assess plasma level glucose, and these can differ. The whole blood contains also the red blood cells, which are not in liquid form, so it gives somewhat higher value for the glucometer, whilst in lab settings it can give a lower value because it is only the plasma that they are checking. So here the take-home message for this particular one from my side is that be aware that differences can exist in a typical lab setting test done to determine your glucose level, and just using the glucometer to do that. But also the glucometer is very useful even in the medical facility setting, especially when somebody is in coma and you need to determine their sugar immediately and you don't want to wait several days to get lab results. It is ideal to use it immediately. But again, it should be very well calibrated to provide near accurate results as that of lab test will do. I think Rhoda has something to say on this as well. So,
well, I think you tackled all the important points. But one, for people who are diabetic who are already tracking their glucose level, this kind of strips, if you use a Lancet or if you use a glucometer at home, it always have this code or batch. The strips come in batches, and if you want to compare one test for today to that of yesterday or tomorrow, it has to be from the same batch of a strip container that you compare with, because variation can also happen within this kind of batches. So then it's also very important that we take note of that. And just to also give them a bit of tips for people who track their glucose level at home often, it's best if you take one measurement before meals and also after meals, because if you're already diabetic, then you have to, there are certain range you should not hit, because then it's everything escalates for you. Then so it means that as you're tracking before your meals, you can usually check to see how you are doing. And also right after a meal, you can also check to see how your glucose level is going, to see if it doesn't go beyond what your healthcare practitioner, depending on the kind of strip or testing method you're using, has told you to check. So then you can do that. And also randomly, you can also check all these things. And if you're already diabetic and you feel sick or you don't feel so well, one of the first things you should test is also to check for your glucose level. And so it's good to have all these self testing tools at home. And I also advise that people invest in this kind of thing. As we are aging, we should have some of these things at home to check for your own blood pressure. Now they are on the hand to go. We have a lot of easy access that does not require so much education for us to read. And you can also have all these things at home to help you.
Okay, thank you very much. So yeah, the testing, how often should we test? Is it like once in 6 months, once in a year, once in 2 years? And you can distinguish between people who are prone and people who are not prone to the risk factors.
Oh, okay, I get your point. So, when Rhoda was speaking previously, she made mention of when you are 35 above. I was also even going to say, so if I'm not 35, I shouldn't be. Okay, that's why it's important to revert to the previous discussion on the risk factors and the signs and symptoms. I think that the more you so let's say that we are already saying that people who are with certain ethnicity, Black people, are just because you are Black, you are at risk, right? And then again, you are obese. The same person is 35 plus, or let's say 40 years, right? And then maybe the same person is not exercising. You have maybe out of the 6 or 7 risk factors, you already have 4. And then this person is also exhibiting about 3 of the symptoms we have talked about. So sometimes I may not even put an age cap on it, but rather I would suggest that the person should be able to do it as maybe once a year or 6 months, every 6 months, to be able to at least know that they are not nearing, or even if they are nearing, they can put some preventive measures in place.
All right, that's very nice. Thank you. Anyone else anything to add before we wrap up? You're muted.
Thank you. On the glucometer issue, Enoch threw more light on it, and he was highlighting more on the calibration. I mean, mostly, the glucometers are in the hands of the non-professionals, ordinary person. So when you talk of calibrations, what do we do to make sure that it's calibrated? Is it that we regularly have to take it to somebody to see whether it's well calibrated, or to the ordinary person, what do they have to do so that they are not just taking the values and interpreting it when the glucometer is not well calibrated and it is giving them false information? What can be done?
Yeah, maybe one thing I will add to what Rhoda said initially is that also the storage of the strips is very important. If it's not well stored and maintained, it can even affect the result. And I made mention of the fact that to be sure of the accuracy, when you go to the hospital, you can go there with the device, and then they will do it and compare the outcome of the 2 tests, or let's say the 2 results, to determine if it is working within the given range, or if the accuracy or sensitivity is within the acceptable limits. I think that there are lab technicians, biomedical technicians who are working. I don't know how the availability is in Ghana or in other countries, But I think that it's not within, like you said, the hands of the ordinary person to do the calibration. Maybe people can ask around the hospital if there are some technicians or experts to help with the calibration. And the calibration means also doing different tests and then comparing and putting it in the right hand. I don't know, maybe Rhoda wants to add something.
Yeah, I think glucometer is very handy than we can imagine, you know. Most
Okay.
homes in Ghana now, they have a glucometer for testing. And what I would say is that if you first buy a glucometer, if the person who cannot use is someone who cannot read to understand the language in which the steps to use the glucometer comes with. So in that, then when you go for your routine test at the hospital, you can ask your healthcare professional, either the nurse or the doctor, to show you how it is done. Or maybe you can go to the clinic often to do the testing. But if you are aware and you can do it at home and you can read, then I would say that follow the guidelines which have been written in how to use it. But usually what is done is that you have to prepare all your testing supplies first. And for all the home use glucometer, first you have to clean your hands. Maybe in some of our subsequent meetings, if our listeners demand, we can also have some glucometer and show them how it is done. So you have to assemble your tool, and then you have to clean your hands or your fingertip where you are coming to prick. And then you have to insert the test strip. So if there's a glucometer and it comes with a strip, which you have to put in there, the test strip. And if everything works well, the glucometer will signal you to let you know that, oh, you are ready for testing. And then you have to self-prick yourself. So this pricking tool is also part of the package that it allows you to prick yourself. And if you prick it light, you get blood, but it's not really ideal. So you have to prick to feel a sharp pain, like, you know, and then the blood that comes out freely is the one you put a drop and you insert, and then you are able to measure your blood glucose in that way. So I think it's so handy, and most homes, they have this glucometer than we can imagine. But if you cannot read and if you cannot understand, you can always ask a healthcare professional to help you do this kind of test. Yeah. But I mean, I don't know which calibration Enoch was talking about, but I don't think most of them need some serious calibration, but you might have problems using them. And the problems he already outlined to us, that either you are using different batch, like you're using something from another company, using with another batch, or maybe you're not doing it well. You're not using it appropriately, but it does not require a strenuous calibration. That is for the self-testing glucometer, and it's the same as the one we also use at the clinic. It's basically the same. Yeah.
Okay. Thank you. My last question, just before we go, maybe I want to ask, all the tests that you did educate us on, there are ranges, the figures you give as being diabetic, there are ranges. One of them said 200 milligram per deciliter. Other ones to have their own values. So if I am trying to test and I have a certain value, especially if I'm not at the clinic, I'm at home, is there a point that you see that this is at a crisis point that you need to seriously rush to a clinic or for immediate attention? Is there a certain level? You are already diabetic and it's a range. Is there a range that you can say this is a crisis point that I need to seriously rush for medical attention?
Okay. Well, I think if you are this range that Enoch has, example, if you are doing fasting blood glucose and you are greater than or you are equal to 126, it's enough for you to go. Unless maybe you are doing self-testing and controlling at home. And then for the next time, we also talk about treatment, you know, because if you are already diagnosed with diabetes, your healthcare professional will give you a glucometer, will advise you to do self-testing at home. And when you're at a point when you know, oh, this is like I've hit the range or higher than a particular one, maybe 7, or you are in 7 millimole per liter or something, you can take your medication. Either you're taking metformin or other different types of medication. So there are medications that you take to control the levels. And if you take your medication and it's still not under control, then you have to go rush to the hospital. And even usually, if you take your medication and then still you don't feel well, you have to go to the clinic for them to check for you. So I think if you don't have the tool in hand to check, the moment you do the self-testing, I think we don't have that range here actually for the self-testing, but there is a range for that. The moment you do the test and you're above or you are at that range, you have to take medication or you have to go to the clinic to check that.
Yeah, with my closing remarks, I think I had a discussion with Rhoda, and she also mentioned the fact that, for example, gestational diabetes, when you go to the hospital, it's not compulsory. You can opt for it or you can decide not to. And in many cases, mothers or pregnant women, they don't want to do this test because it's like the knowledge of it is something they don't want to live with. But we would admonish that people take it seriously and ask for it, even if it has not been recommended by their clinicians or their medical expert. Because when you have gestational diabetes, what happens is that the mother also supplies extra glucose to the unborn baby, the fetus, and then the fetus grow to a certain size that will be considered as probably overweight for a child at that stage. So they give birth to over 9 pounds baby. And I see that in our settings, some parents, when they have a child and it's a big baby or something, it's like it's like an achievement, but there can be an underlying issue. And because of the size of the baby also can come with a delivery complications. So it is really important to know your status, because if you know, at least you can take measures to reduce the propensity of getting high sugar and then passing it on to the baby.
And
my take-home message is that diagnosis or the early detection, like we said, can save you a lot and can make you put preventive measures in place not to get into a situation of diabetes and its complication, and always seek a medical officer's advice when it comes to determining if you are diabetic or not. And from there, they can help you to know what is the next step to do. They will give you all the necessary advice. Also, like I said, in Europe here, the doctors are very much aware, and sometimes when they know that you are in a certain risk category, when you go to the hospital, you don't have to request for it. They will do it for you. But in our settings, people don't have personal doctors, like I said, to go there frequently and get these recommendations and stuff. So knowledge of your situation should inform you to sometimes walk into this lab and get the results. If you find the result and it's something to worry about, then you can go to the doctor for advice. If you need a prescription from a doctor to go and do this kind of test too, go ask for it and let them do it for you. It doesn't cost a thing. I feel like preventive healthcare should be a priority than thinking about curative. Sometimes when the signs of the disease is observed, the damage has already been caused. So it is important that even though they are saying from 35 you should check, I feel like you can check it as early as possible to know that you are not in danger. That's what I will leave with my listeners, and I will. This was also to prepare us in a way that we can talk about the prevention, control, and management practices in diabetes in our subsequent videos. So they should look out for our subsequent discussion on the topic of diabetes.
Okay, thank you very much, Rhoda, Enoch, and my co-host, Jonathan. It's been a fruitful discussion, and hopefully we'll see all of you next week as we discuss prevention of diabetes. Thank you all.
Thank you.
Thank you.
All right, bye.